Thank you, Sean. Thank you, Naomi. Thank you, everyone. If you have any sort of questions throughout the call, please go ahead and Anshul and Sean, you can chat them directly with any questions about the interpretation or any sort of tech challenges. And then as we're going, if you just have any sort of questions that you would like to pose, we will have time at the end for a Q&A, but please, feel free to put any questions you may have as they come up in the chat, and we will make sure to get all of those together and address them all at the end. All right, thank you so much for being here. So I'm going to go ahead and share my screen, and we will get started. All right, can everybody see my screen? All right, I see some thumbs up. Thank you. Okay. So we just wanted to start today with a little welcome from Roberto. Roberto, I'm passing it over to you.
Hi, everyone. It's really exciting to be here. And first of all, I just really want to acknowledge Community Health Workers Initiative for all their amazing work in helping us get here. We've had already a whole set of organizations working with Community Health Workers Initiative in what we call the first round of this project of COVID-19 health equity, right? So thank you, CHWI in general, Venice, Daniela, Javier, and Benjamin, and Chal. Those are the ones that I can see on my screen, but many others. First of all, thank you. So the second part here is, as we are thinking about this second round of organizations that can participate by hosting a community health workers, I think I just want to provide you kind of a little bit of a wider perspective of what does it mean to participate in this program. So a couple of like key figures here. So over the next year and a half, well, actually starting since last June, June of 2021, to about 2 years from now, we would have invested about $20 million in the workforce, in the community health worker workforce in New Mexico. This is not only NMDOH. I'm speaking about partners across the state. So when you think about the number of organizations and groups that are interested in working with community health workers, think that you, if you apply, will be participating in that larger initiative of like trying to increase the workforce, the community health worker workforce in New Mexico, but also more important, that the workforce is hopefully going to reach out to the most vulnerable in New Mexico, which I think it's really one of the main goals too as well. So that's one key item. Also, as you think about the whole like vision of the community health worker workforce in New Mexico, the Office of Community Health Workers within the Department of Health, the New Mexico Department of Health, has a renewed vision of where to move forward, right? Which includes how do we provide the tools to the workforce so that the workforce can perform appropriately. So as you participate in this program with CHWI, one of the partners running this initiative, you will be helping not only to, by hosting community health workers, by training them, by developing your organizations in that sense, but also you will be participating in the whole movement in devising or informing tools like data collection tools or data platforms that we can use like statewide. How do we, for example, do evaluation or quality assurance of community health worker programs, and how can we share that with others outside the network within New Mexico? So your participation is also going to help inform that. The last point, 3, I think when we say more than 3 or 4 points, nobody remembers what the person said. So I'm just going to give you 3. The third point is that as we are moving to improve the community health worker workforce, we are hopefully working towards reimbursement of community health workers. We are working tightly with Medicaid in trying to set that up, as well as thinking about other financial resources. So big picture here, I just want to get you excited and motivated to participate in this opportunity. You are not only participating in one program that is going to, and you'll hear what the outcomes is going to be. You're going to hear from Daniela and Javier about what the expectations are. But all of this, it's not within a small reduced world, but within the larger picture of New Mexico, where hopefully we're making a change in the workforce, improving the ability of the workforce to reach to the most vulnerable, data collection, reimbursement. So you will be part of a larger picture across New Mexico. So I just want to thank you, for your interest of being here. It is really an honor to work with organizations who are serving those who are in most need in the state of New Mexico. And for that, we are eternally grateful. And hopefully you will find the information here useful, and we hopefully can make it as easy as possible for you to participate in this program. So I'll pass it back to you, Daniela. Hopefully, that incentivizes you in some way or another to participate and continue working with us and to apply, in the process. So thank you very much for being here.
Wonderful. Thank you so much, Roberto. We appreciate you being here and kicking us off. Just sort of quick agenda. So we're just going to we're going to start with sort of just going over the Health Equity Project overview. I see many familiar faces here, so I'm sure that some of you will be familiar with it, but the COVID vaccine work specifically that is happening currently. And then we're going to be talking about the behavioral health expansion. And I know a lot of you on the call right now are planning on applying or are really interested in applying. So we're going to really talk about sort of the nitty-gritty, the application process, the funding, requirements and deliverables, training, stuff like that, so that you have all the information. And then, like I said, we will have Q&A time at the end of the call. So please, any questions that you have as they come up, feel free to go ahead, write them down or put them in the chat, and we'll make sure that we address them all at the end. So this is our amazing community health worker team, our internal team of CHWs. And this is the rest of our team. This is sort of the leadership support and training. My name is Daniela Matthews-Trigg. I'm the senior program manager of the new behavioral health program. And Ben, do you want to introduce yourself?
Good afternoon, everyone. My name is Benjamin Fox. I am the compliance specialist with this fabulous team. I see a lot of familiar faces on this call, and all the new faces, thank you for jumping on and joining us. And we're really looking forward to sharing some of this information of this new program.
Thanks. So first we wanted to sort of do like a very zoomed out sort of explanation of kind of the two different pieces. So this is the Vaccine Equity Project and the soon to be Behavioral Health Equity Project. They're both sort of a collaborative project of DOH and UNM, specifically the Community Health Worker Initiative, which is our department. So we have sort of pretty separate roles while working very collaboratively on this project. So DOH does, the funding, monitoring, evaluation, that piece, and support around that. We will be talking more about sort of more specifically what that looks like later. And then also they do the sort of coordination piece between partner agencies and sort of planning and building future strategic partnerships as well. And then on our end, sort of the UNM CHWI side, we do the training. So we have a team of coaches, our training support analysts. Some of them are on the call today. If you're on video, just give a little wave. And then we also have technical assistance around the training. Sean will talk a little bit later more specifically about sort of the training curriculum for the Behavioral Health Project. And then we also work around sort of capacity building through that training. And it's sort of intensive training at one point and then ongoing training through the course of the grant. And then we also do sort of the administrative support side. We have supervision tools. We're sort of constantly developing those in partnership with our partner organizations. An operations manual, billing, scopes of work, that sort of thing goes through the UNM side of things. So the Vaccine Health Equity Project. So this project, many of you are familiar with it. Many of you are our current partners right now. So developed in 2021, it's a collaboration between DOH and CHWI. The goal is to increase equitable COVID vaccine confidence and uptake around the state of New Mexico, with a real sort of focus on underserved areas, and places that have high social vulnerability index and low vaccination. So all of those are sort of the goals. There's currently 15 partner organizations around the state. And right now, the 5 CHWs that you saw on the first slide, those are our internal team, and they focus on Bernalillo. And then the other 15 partner orgs are throughout the state, focusing on different communities. So the reason that the behavioral health expansion is taking place is there is sort of a large federal conversation happening right now about behavioral and mental health. So COVID fatigue is real. We all know that here. We're all exhausted. And while it's so important to be continuing to talk about it, we also want to be able to expand the scope of the conversations community health workers and community health representatives are having with their communities. I think so many of the partner organizations have expressed that they would like to sort of expand the scope, expand the work that they're doing. And so this project is sort of really listening to what communities are asking for. So the goals of this project are to increase behavioral health access and knowledge, and those sort of conversations about behavioral health throughout New Mexico and communities. Increase awareness of behavioral health itself and what resources exist, and then to also sort of asset map and identify what gaps exist in communities around behavioral health resources that are available, and sort of record that information and then be working together with communities, with CHWs and CHRs to advocate for an increase in resources. Also, destigmatization, that's a big piece of this as well, is to really be able to talk about and destigmatize behavioral and mental health within communities, and then also provide accurate information and connection with existing support services for people. So those are the goals that we're doing. So a big question that we're getting from current partners, and so this is for the current partners in the group, is how is this going to affect current funding? So we want to be really clear. This absolutely in no way will affect your existing contracts. If you have a contract with us right now under the Vaccine Equity Project, there is no change to that contract, no change to your CHWs, anything like that. So, and we're sort of trying to, so there's sort of two pieces here, and I'm not going to go too much into this because we are going to be continuing to follow up with existing partners to sort of have more conversations about this, but just so that everybody's not confused. So the behavioral health piece that we're talking about today is a new contract. It's a completely new one. Current partners and new organizations are all welcome to apply. But existing partners, this is a completely separate thing. You are welcome to apply for this new contract or not. We will be adding in the full behavioral health piece to your existing contracts, but that is sort of separate. Then this is a whole new contract. And we will be following up with existing partners for like an info session on that, so please stay tuned. So the new behavioral health contract. So funding for this is $60,000 per CHW or CHR full-time position. Available funding is $90,000 over 18 months with a monthly drawdown of $5,000. with monthly invoicing, which will come directly to us at the university. So the agreement becomes effective upon the execution date. We're really hoping for as early in January as possible so we can get the full number of months in there, and then it goes through the end of June 2024. And organizations, you are welcome to apply for one full-time CHW position or multiple. It's just sort of whatever you feel like you have the interest and capacity in hosting at your organization. So funding covers one or however many positions you'd like to apply for, FTEs, community health workers, or community health representatives. We don't have a sort of a salary that we are sort of mandating, but we do have a salary minimum that we are requiring. So it's $17 an hour for CHWs, and if they are certified, it's a minimum of $18 an hour. It is possible to do part-time. So to do like 2 part-time FTEs, 0.5, that is also possible as well. So built into that 60,000 or the 90,000 over 18 months is that covers the CHW position. It also covers a percentage of a supervisor salary because we really are sort of prioritizing and wanting to work a lot with CHW supervision and sort of building capacity within organizations. So we do recommend like $10,000 toward that supervision salary, but that is sort of ultimately up to your organization internally. And then for the remaining funds beyond those 2 sort of salary pieces is administrative fees, travel costs, sort of infrastructure, technology, stuff like that. So this is a sample invoice. This is pretty much what it will look like. But as you can see, these are sort of the different sort of sections, the CHW salary, cell phone, supervision, those kinds of pieces. And then it's up to your sort of organization internally, how that's divvied up. But each month it just has to total to that $5,000 monthly drawdown. And this is the invoice that organizations will be using and submitting. So this is exactly what it will look like. Ben, do you want me to pass this over to you?
Thanks, Daniela. So what are the requirements and the deliverables that we are asking of our potential partner organizations? The first is to provide staffing. So the big one is just providing that the staffing for however many FTE positions are awarded. What is written into the contract, what is written into that kind of financial breakdown, and what our expectations are that the CHW or CHR positions funded through this contract are working on this effort. We, as has been mentioned several times, and really trying to be in line with the idea of equity throughout our communities, really trying to expand that also to our workforce and having that equitable workload within the CHW and CHR workforce. We really don't want kind of the existing workforce to be saddled with and to have to take on this additional expectation and workload in addition to what they're already doing, so that these CHWs would be just working on this effort. We really want to build the CHW capacity and the behavioral health capacity throughout the state, and so we want to make sure the staffing structure reflects that. Organizations and individuals would also another requirement is to attend ongoing trainings. You're going to hear from our fabulous training specialist here in a moment. All of our existing partners, you've got to experience the incredible trainings that Sean is able to put on, and those are going to, there's going to be similar expectations with attending initial trainings and then ongoing trainings to try and help build that capacity, build that knowledge and structure within the workforce. Tracking activities, data, and participating in evaluation activities. We'll be sharing some more about what the monitoring and evaluation looks like, but our partner organizations would just be participating in that data collection and that evaluation. Maintaining regular communication with the CHWI team. We really want to support our community structure, and we have a staffing system in place where we have our fabulous training support analysts, who are these great coaches who can help support our organizations. We have our management team and our training team who really want to try and support our organizations and build capacity. So maintaining regular communication so that we can better support you all. Providing materials and the support for the CHWs and CHRs that are funded through them. So, helping with just kind of the day-to-day activities and meeting the programmatic goals. And then also just providing other guidance and supervision in order to have that, that really effective support and really effective staffing. And handing it off to Sean, our fabulous training specialist. Sean, you want to tell us some about the training?
Yeah, absolutely. Thanks so much, Ben and Daniela, and thanks to everyone who is joining us today. If you don't know me yet, I'm Sean Stambaugh, and I am training specialist with this team at CHWI and the 2 health equity projects that we have now. Right now, the training vision is still somewhat in development, and so I can't offer full specifics. For those who are current partners, I can say that things like the Cultural Humility Training Series will not be ending. That will continue on. It feels very relevant for this work. So some of the threads of training that we've already started, including MI, those will continue and will be modified to include some of this behavioral health focus more specifically. Aside from that, specifically with this new behavioral health initiative, I am planning to run a program orientation, something somewhat similar to the 4-day orientation that was run for the launch of the vaccine equity project, but probably not quite as long. We'll look at destigmatizing behavioral and mental health, which I think is a really important issue in any community and in our communities as well. Looking at some outreach strategies that center around behavioral health and how to communicate during those outreaches about behavioral health. Looking at behavioral health and mental health 101, what are some of the terms that are used, the abbreviations, the things that get thrown around that can be jargony language that is hard for folks to understand if they aren't a part of that world. So looking at like what is the difference between an IOP program and an intensive outpatient program or a residential stay program in treatment of behavioral or mental health issues. And of course, we'll also be taking a close and accurate look at 988 and the services that line currently offers, the services it is developing and plans to offer in the future, and how there might be intricacies and specifics with how those services differ depending on your location within the state. So really want to be thoughtful and provide very accurate, specific, detailed information about the efforts that are around. We've heard feedback from CHWs that one of their priorities is to make sure if they're sharing information, that information is accurate, that it is something that they can trust and that the folks who they're sharing it with can trust. So that's a really big focus of ours as we begin to roll out trainings around these topics. So I think that is it from me. There's more stuff being developed. I try to take a very thoughtful approach and pull in lots of different folks and subject matter experts as I move forward with this vision, but that's what I can offer for now. Thanks so much, and I will pass it back your way.
Thanks, Sean. I'm going to be stepping in for Dr. Sonia Shin to go over our monitoring and evaluation. Those of you who know Dr. Shin on this call will know that I'm a very poor substitute for her, but I will do my best to cover our monitoring and evaluation section. So the heart of our work and the heart of not only this project, but many things that we are trying to build and grow within CHWI are based on these community-based participatory approaches. So what does that mean? The first part is that we really want this initiative and our work to be community defined. We want to have these initiatives target not only the needs, but also the assets that are present in the communities. We want equitable collaboration. We want to share in the process of of hearing that dialogue and that conversation of what is important and how do we collaborate to address those needs. And then what do we do with the information? What do we do with what we learn collectively through this process? And we really want to focus on outcomes and have equitable outcomes that are beneficial for our community and for our partners. So this, the monitoring and evaluation, and so this cycle is set up in a learning cycle. So first, starting with that targeted approach. So really focusing on those community-defined aspects, and then helping to build and train that workforce in addressing those needs. So the section 3, 4, and 5 here, I think our data team, our Sonia's team, we have some members on here. I know David's on here, but they have done a tremendous job of gathering this data and then sharing that data back with our community and our partners. We also are able to use our TSAs and other of our staff to really help support community organizations so that this data that we're collecting, we're able to put back in a format that is able to be shared with and help inform and reshape this collaboration and the efforts that our community partners are doing. So instead of us just collecting that data and sending it up to Department of Health or holding on to it, we want to sit back down with all of our community partners, look at that and say, what does this mean to you? How do you want to use this? And how can that shape what we're doing? So what is going to be tracked? So there are several reports that are required. So the first is monthly reports, and these really relate to the behavioral health outreach and education efforts, and kind of what is done throughout the month. In this, there's going to be goals that will be set at the beginning of the month, and then we just want to hear, how do you feel like you did meeting those goals? If you didn't, what were some barriers you encountered? And then what did that outreach and education look like? These monthly reports would be due by the 5th of each month. There's also the quality improvement checklists that there are these very supportive supervision-based activities. It'll be a monthly QIVC meeting that are structured to allow a really collaborative dialogue around what is happening in your communities and what can be done to address any needs or barriers. Also, with the quarterly reports, these are focused on, again, looking at what challenges you're encountering, what barriers you're encountering, and what, is there need for any more support. These are due every quarter, and they're on the 10th of the month of that quarter. Additionally, there are annual reports, and these are more so the key performance measures and the big lessons that you've learned throughout the year. And if an organization is funded through both the Vaccine Health Equity and the Behavioral Health Equity Program, only one annual report would be due per organization. So wouldn't have to kind of duplicate that report if you're funded under both contracts. And then the last bit of tracking and monitoring would be 360 evaluations. So having that review and getting that feedback of supervisors and the CHWs. So the idea is you can, as an individual, whether you're a CHW or CHR or a supervisor, or us with our team, we're getting that feedback from kind of everyone around us on what are we doing well, what can we improve on. So those would be due in January. Continuing on with this, a big thing, like Sean mentioned briefly, and that we've kind of talked about in passing, is asset mapping. So we want to identify the strengths of communities. We want to take this asset-minded approach rather than always focusing on needs, but what is available in a community, and being able to identify service providers and what is available around mental and behavioral health. And then from there, we can build on that asset mapping. We can create a directory of available resources, and then we can start to focus on what can we build on from there. So also CHWs and CHRs will track individual encounters. So working with de-identified information about those encounters, and that includes individual needs, community needs, and referrals within those assets, within those available services. And then also documenting what is going on within your outreach. So community events, organizational events, social media outreach. What is your engagement with your community in all of these different types of outreach and engagement? So moving on to our application and consideration. So what do successful applicants, or what are we really looking for, and what do we really want to see from applicants for this project? We really want to see and hear about how organizations engage with their community and engage with members of their community who are historically marginalized and may experience high social vulnerability. How does your organization contribute to the adaptation of this model as a whole? How would you adopt this model and try and use it to focus on those assets and build that capacity within your community? How would you integrate this outreach model and this engagement model using your CHWs or CHRs or new CHWs and CHRs within your organizational structure? How would you plan on supporting and supervising these individuals within your organization? And then how would you collaborate within this this program and this resource building and capacity building efforts as a whole? So the application is live now. It is live on REDCap, and it consists of four sections. The application is scored, and it is scored out of a total of 120 possible points. Out of those four sections, 2 are scored and 2 are unscored. But even the unscored sections will still be evaluated by our review committee, and that the information that is presented in there will be used in the decision process. So section A. The statement of interest. So this is a maximum of 1 page, and it's one of the scored sections with a total of 20 points. So here we want to get a brief description of your organization. This is, if we're not currently working with you, and even if we are, this is just another introduction. We want to hear about what your organization does. The information, get some information on the clients and the community members that you serve. What type of activities do you see your organization and your CHWs or CHRs engaging with your community? And also the number of CHWs or CHRs that you would be applying for. Section B is our questionnaire. So this is a total of 100 points, and you'll see on the screen each question, the points that are associated with it. So the first question is for, are you currently funded under the Vaccine Health Equity Project? If yes, we want to hear about some of your experience with that. Do you feel like you've been able to meet your deliverables with that project? Have you encountered any barriers? Are there barriers that are preventing you from meeting those deliverables? And what are you doing, or what have you done to overcome those challenges? This is an unscored section, but like with the other unscored sections, or excuse me, this is an unscored question, but like the other unscored sections, your response to this will be considered by the evaluation committee. Question 2, here we want to hear about your organization's mission and how does it relate to this behavioral health outreach and this behavioral health initiative that we are launching. Question 3, how does your organization integrate or utilize CHWs to serve this mission, to serve the mission that you have described earlier? Question 4, do you what is your organization's investment and experience in addressing health equity? If you don't have experience in this, what do you want that experience to become? How do you want to utilize these resources and build within this system? Question 5, does your organization currently work with CHWs or CHRs? And then if so, describe some of your experience working with these with CHWs and CHRs. Question 6, this is focused on looking at your geographic reach of your organization and your community reach. So, what geographic reach do you have? What communities do you serve? And what populations do you serve? Question 7, this is looking at some more of that capacity. So questions focused on, some of the nitty-gritty things like, do you have space for these CHWs to work? Do you have internet access? Do you know how to invoice? Do you invoice with us already? These answers to these questions aren't, they don't. They're more so for us to get a better understanding of what can we do to support you and help build that capacity within your community and your organization. So if we're seeing that a lot of community organizations don't have reliable internet access, that helps us think about how we can better support those organizations that need that access. Question 8, if you are awarded funding for these CHW or CHR positions, what would your plan be within the first year to conduct this behavioral health and 988 outreach and education? So what is over the first 12 months, what is this going to look like for you? Question 9. Diversity, equity, and inclusion are very important for the work we want to build and support, and our team in general. And we want to hear about some of the DEI work that your organization does and how you would continue to strive toward those diversity, equity, and inclusion efforts in this program. So section C. This, we want to see what your staffing model looks like. So your organization's proposed staffing plan, how many CHWs are you applying for? And then how would you use those full-time equivalents if you're awarded them? Just a quick point here. Just because you apply for a certain number of full-time equivalent positions doesn't necessarily mean that if awarded funding, you would be awarded funding for all of those positions. It would be made very clear in the award notice how many positions you would be funded for. So just wanted to take a moment to mention that. And section D, we want to see a proposed budget. So within the application, there's the ability to download that blank sample invoice that Daniela shared earlier, and then fill that out for how you would see your monthly invoicing go for however many positions you're applying for. The template is embedded in REDCap and you can download it. The highlighted cells are the cells that we encourage you to complete. And then once you've completed that, please upload it back into the REDCap application before you submit it. Some last things to keep in mind. So we know that hiring can be a major barrier for individuals. One thing to mention is that the organizations and individuals can't start working for or bill for any work done on this contract or under this project until contracts are signed. So you're not able to bill for anything prior to the contract execution date. However, we would really encourage organizations to begin looking at how they would want to start hiring for and staffing this position if they're awarded. We also, if you foresee major barriers in the hiring process or in getting any of this project implemented within the time period that we've projected, we want to hear that. It doesn't mean that we wouldn't consider you to be a potential partner, but we want to hear how we can support and help you overcome those barriers if you're awarded. So the applications are live now. They are going to be live for 2 weeks, and they're going to be closing on November 16th. So you have until, I believe it's midnight of that day to submit them. After November 16th, we are going to get together with our evaluation committee and start going through the applications. Beginning of December is when we're going to announce the awardees. Our target start date is beginning of January. As anyone who has contracted with us in the past knows, UNM can, it's a big institution, but we really want to try and have everything ready that we can start with work, that we can have the contracts, the start dates in January of 2023. With a start date of January 2023, the projected trainings that Sean has covered would be starting in February of 2023. All right, and I'll hand it off back to you, Danielle.
Thank you so much, Ben. Yeah, so that is a lot of information downloaded to all of you. We definitely have some time for questions. Feel free to raise your hand. And I know that Anshul has been compiling some of the questions. So I'm going to stop sharing my screen and we can answer some questions.